Let's begin with the important topic, that is coronary artery bypass graft, which is more commonly called as a CABG surgery. And it is also known as a heart bypass surgery. It is a procedure to improve the blood flow to the heart by creating a new pathway around the blocked or narrowed arteries, often using veins and arteries from other parts of the body. So if you see, this is the vessel. This vessel has the collection of the plaque inside the arteries, and because of that, the vessel has become stiff and it has become narrowed. And this particular condition is called as atherosclerosis. And because of that, the blood supply gets narrow, and that's why we do this coronary artery bypass surgery. So we have seen the CABG surgery is performed to treat the coronary artery disease where the plaque buildup restricts the blood flow to the heart. Now, where are the vessels harvested from? Because we will require the vessels to create another road for the blood to pass through, and that another road is called as a bypass. So we pick up the vessels from the leg, that is the saphenous vein, the internal mammary artery, which is located in the chest, and radial artery, which is located in the arm. And these are the most commonly used vessels for the CABG. Of course, there are some other vessels also, but these are the most common. Now, the harvested vessels are then connected to the aorta and the coronary artery beyond the blockage, creating a bypass that allows the blood to flow around the obstruction. Now, the harvested blood vessel is grafted to the outside of the heart to bypass an area, the blockage or the occlusion. A single vein or artery may be sutured at the site of the disease to more than one coronary artery. CABG performed for severely clogged coronary arteries. Codes are determined by the number of the vessels used as a graft, not the number of the coronary vessels. So this is the part which is not getting enough blood supply, because there could be the clogging somewhere, and then we create a bypass like this, and because of that now the clog has gone, or we have created the alternative route, and because of that now this part has come back to the normal. Now, what overview one must take while solving the cabbage question? So, first of all, we must know the material they have used for the graft. Does it come from the artery, vein, or both? Then, how many venous and arterial graft were used? Then the third question is harvesting the vessel separately reportable? And the fourth question is, what other procedures were performed? Because during the cabbage, we may end up doing some other procedures. So that we are going to see later. But if those procedures are done, then we need to take those procedures into consideration, and then the coding hierarchy will change. So what are the types of the vessel used in grafting cabbage? So we can use veins, we can use arteries, or we can use arteries and veins. So we have the code for the veins, that is 33510 to 33516. I'm going to show you those codes so that it will be easier for you to understand. Then we have a separate code for the arteries. And then whenever we are using both the material, arteries as well as the vein, how do we code it? So let us begin one by one. Now these are the code for the vein grafts only code. That means whenever we have used the vein as a graft material. And if you see the code, it starts from 33510 to 33516. And they talk about one vein graft, two vein grafts, 3, 4, 5, 6, 7 and more. So these are for that. Now these codes are for the arterial graft only codes, and the codes are again 33533, 534, 535, 536, and it talks about one artery, two arteries, three arteries, four or more. So whenever artery as is been used as a material for the grafting, we use these codes. Now this is a very important slide, so I want your complete attention. Now we are coding for the AV code. So these are the combined graft. Combined graft means we are using artery as well as the vein graft. Now in this case, for the arterial part, we are going to use the code 33533 to 33536, which we have seen earlier also for the arterial graft. But for the vein graft, we code it from this. So what are the code for the vein graft? So add-on code for the combined arteriovenous graft selected by the number of the veins used. I use this code 33517 and 33523. And these codes also for one venous graft 2, 3, 4, 5. So let's take an example that for the CABG I have used one artery and one vein graft. So how do I code it? So for the arterial part I will code 33533 and for the venous part I will code 33517. This is only whenever we are using the AV code, AV grafts. But if it is only vein, then the code is 33510 to 33516. Remember that. This is very important. Now, next we talk about harvesting. What is harvesting and is harvesting is separately reportable. So the arteries and veins are harvested or taken from other areas of the body to use it in the bypass procedure. Because bypass is I am creating another road. How will I create another road? By putting another vessel. From where will I take that vessel? I will take the vessel from patient's own body. And that vessel is called as a harvesting of that vessel. So I take that vessel from different areas. So it could be your mammary artery, it could be your saphenous vein or radial artery. And so whenever you are doing this harvesting, sometimes the harvesting procedure we report separately, but sometimes we don't report the harvesting procedure separately. So this is very, very important for you to pay attention to. Is harvesting of the artery separately reportable? And the answer is no and yes. No, depending upon which vessels we are using. Arterial graft codes include use of internal mammary artery, which is also called as the internal thoracic artery, gastroepiploic artery, epigastric artery. So whenever we are using this artery as a graft, we do not code them separately. Why? Because whenever we are doing the CABG surgery, we have already done the thoracotomy. That means we have cut open the chest. And I can see already the mammary artery there. I had to just cut it from here and put it on the chest. It does not require any additional work for the surgeon. And that's why whenever whenever these vessels are used as an arterial graft, we do not separately reported. So is harvesting of arteries separately reportable? Yes, in some instances we have to separately report it, and that is when will we separately report? When the arterial graft codes are from the upper extremity artery, and for that we will code 35600. So in this case, we will use two code, one for the CABG procedure and one for the harvesting of the artery. So the conclusion is the procurement of the artery for the grafting should not be reported as a separate service or a co-surgery except when the upper extremity artery is procured. To report harvesting of the upper extremity artery, we use the code 35600 in addition to the bypass procedure. And 35600 is an add-on code. So I will report the arterial graft code first, followed by this code. This is the procurement code or the harvesting code. Now let us see harvesting of the veins. Harvesting of the veins, is it separately reportable? Then for that also we have answer no and yes. No, when the harvesting a saphenous vein is included in the CABG code and we do not report separately. So whenever we use the saphenous vein as a graft, we do not code it separately. Harvesting of the vein separately reportable? Yes. in some instances we have to code it separately. When we use the upper extremities vein, for that that is radial vein, when I will use it, I am going to use the code 35500, and femoropopliteal vein, the for that the code is 35572. So whenever I am making, or whenever I am taking the graft from these two vessels, I'll have to code them additionally. So this is again very important. So summary is, for the procurement of the vein for the grafting should not be reported as a separate service or a co-surgery, except when upper extremity vein, that is a radial vein, that is 35500 is procured, or femoropopliteal vein, which is more famously called as the fempop vein, and for that the code is 35572. We will code it in addition to the bypass procedure. So use 35500 in conjunction with the vein graft code. This is a CABG endoscopy code, and it is an add-on code 33508. The code language says endoscopy surgical including video assisted harvest of the vein for coronary bypass procedure. Traditionally, the vein harvesting happened by taking the long open incision. Okay, but nowadays, because of the medical advances, we use the endoscopic method where the incision taken are small and it is more cosmetic. When the vein has been harvested by this mean, that is by endoscopic means, we will have to code it additionally. Then it is not included in the graft code, we will have to put an add-on code. So these are the two important code that we will use it whenever we harvest the particular graft material endoscopically. To report the endoscopic harvesting of the vein for the coronary artery bypass procedure, use 33508 in addition to the code for the associated bypass procedure. To report the endoscopic harvesting of an upper extremity artery for the bypass procedure, use code 33509. So 508, it is the code I will use it for the harvesting of the vein, while 509 I will use it for the upper extremity artery. So this is that specific. So whatever you have endoscopically harvested, whether it is a vein or artery, depending upon that, the code varies. Now let us take a quiz that will help you to understand the concept better. So a coronary bypass procedure uses 3 arterial graft but no venous graft. The physician harvests internal mammary artery for the procedure. Now, how to solve this kind of a question? First is graft done with arteries, vein or both. In our case, it is 3 arterial graft, no venous graft. How many venous or arterial graft? 3. Is harvesting vessel separately reportable? In our case, it is an internal mammary artery. And if you remember, internal mammary artery harvesting, we do not code it separately, because I mention you why. Because we have already cut open the chest, we are doing the CABG, the internal mammary artery is within that area, so the surgeon is not doing any additional work. So let us see the answer. So my answer is 33533, coronary artery bypass using arterial graft, 3 coronary arterial graft, and that will be my answer. A coronary bypass procedure uses 1 venous graft and 1 arterial graft. The artery graft was epigastric artery. The vein graft was femoropopliteal segment. So let us have our drill. Graft done with arteries, veins or both. In our case, what is the thing? It is 1 venous graft, 1 arterial. So it is both 1 venous and arterial. How many venous and arterial? 1 and 1. Is harvesting vessel separately reportable? Now there is one epigastric artery that they have used, and secondly is femoropopliteal segment. So put all these things and have your answer ready. So the answer is 33533. This is a coronary artery bypass single arterial graft, for which we will take the code from here 33533. And since it is a AV graft, because they have used the artery and venous, so for the venous part we are going to come to this codes. Okay, and in that I am going to use the code 33517. So this is only whenever we have a AV graft. For the arterial part I use this code, and for the venous part I am going to use this code. And 35572 is for the harvesting of the femoropopliteal vein. So along with the CABG, if any other procedures are performed like endarterectomy, then we have to write that along with the code 33572. This is the code for the coronary endarterectomy. Now use this code only with 33510 to 33516 or 33533 to 33536. If multiple vessels are treated, report the code for each vessel. And endarterectomy, it is a surgical procedure to remove the plaque from a narrow or blocked artery. It can be used to treat a carotid artery disease or peripheral artery disease. So along with the CABG, if we have done any of this procedure, we need to report that separately. Now let us take one more quiz. A coronary bypass procedure used one arterial graft with three venous grafts. The physician harvested the saphenous vein arteries for the procedure using an endoscope with video assistance. The physician also performed an endarterectomy of the circumflex artery 1 graft done with arteries, vein or both. Now, how many venous and arterial grafts were used? There was one arterial and three venous grafts. Is harvesting vessel separately reportable? Yes, because there was a saphenous vein that has been harvested, but it has been harvested endoscopically. What other procedure were performed? There they performed the endarterectomy. So that is also performed, and we just see in the slide that if any additional procedure is performed along with the CABG, we need to mention that additionally. 33533, one coronary arterial graft, 33519, three venous graft, 33508, endoscopy for harvesting of the saphenous artery, and 33572, coronary endarterectomy, which is an additional procedure they have done along with the CABG that we will have to mention additionally. Now let us take few examples that they will ask in the exam. Dr. Richard performed a CABG surgery on the David Fred 5 months ago. Today, Dr. Richard completed another coronary artery bypass using three venous grafts with a harvesting of a FEMPOP vein segment. How would Dr. Richard report her work for the current surgery? So what has happened is the patient had one CABG surgery 5 months back. Today she is undergone one more surgery that happened with the three venous graft, and that graft material is from the FEMPOP vein. So enough data with us for us to zero down the right answer. So first eliminate the wrong option. So what is it? This is the venous graft. So let us see what are the code. So 33512, it is the code for the three coronary venous graft, and 33535 is the code for the arterial graft. We definitely do not need that code because it is a venous graft. That automatically eliminate my option B and D. And if one option is one code is also wrong, that eliminates the complete option. So B and D has gone, and we have end up with A and C. Now let us see what is the second code. The second code talks about 33530. It is a reoperation coronary artery bypass procedure or a valve procedure more than 1 month after the original operation. So in this case, the original operation happened 5 months back, and this is the second operation. So we will require a code 530, and 35572, it is the code for the harvesting of the FEMPOP vein. So we will require this two code. Now let us see what's our answer. So our answer is C. And if you see here 530 and 572, these are the add-on code. And if you remember that we never put a modifier 51 on the add-on code, we can eliminate the option A without even seeing whether the code is right or wrong. And then you have this answer 33512, it is a venous graft, 530, it is for the reoperation, and 572 for the FEMPOP harvesting. Old patient undergoes three venous to arterial CABG using the saphenous vein, femoropopliteal vein, and a radial artery harvested by the surgeon performing the graft. The venous graft were procured using endoscopic harvesting technique. What CPT codes are reported? So there is a lot of information here and you have to be extremely careful in doing this question. We have 3 venous, 2 arterial. So this is a case of AV graft. And for that we will require the arterial graft code from 33533, but venous graft code are the add-on code. Always remember, in AV graft, whenever it is a AV graft, arterial graft code are the primary code, but the venous graft code are the add-on code. So we can, by seeing that, we can eliminate 2 wrong options, because 33512 is not a add-on code, and this is the venous graft, but I cannot use this code. So that code is wrong, and even 33514, that's also the primary code, that also I cannot use. So I'm going to eliminate the option A and C, because those are not the correct option. Now in between B and D, we have to just zero down our answer. So answer is B, 33534. It talks about the 2 coronary arterial graft which we have. 33519, it is the 3 venous graft, list separately in addition to the code for the primary procedure. So this is for the 3 venous graft. And 35572, it is the code for the harvest of the FEMPOP which we have. Then 35600, it is for the harvest of the upper extremity artery, one segment, that is radial artery. And then 33508, this is for the endoscopy surgical, including video assisted harvest of the vein. So that's why all this are there in B, and that's our. A physician performed a 4-vessel autogenous coronary bypass on Anthony, again, who had a previous CABG 2 years ago, utilizing saphenous vein, radial artery, and the left and right internal mammary arteries. Select the CPT code. Let us have our drill. What is it? It is a AV graft, and it has 1 venous and 3 arteries. This is the first important information. So let us see the first code. In that first code, if you see, 33533 talks about 1 arterial, 534 is 2 arterial, and 535 is 3 coronary arterial. In our case, it is a 3 arterial. So we will require a code A and D. B and C is not a correct option. If one code is also wrong, that option is automatically eliminated. Now the second 510 and 517. 517, it is an add-on code, and for the AV graph we will require a add-on code, and we have 1 venous, so 33517. So these 2 codes are right. Now let us see what is this, what are these 2 codes, and we can zero down the. So 33530, it is the code for reoperation, coronary artery bypass procedure or a valve procedure more than 1 month. And in our patient case, it is a 2 years. And 35600, it is a harvest of the upper extremity artery. And in our case, radial artery, we will have to code. Saphenous vein, there is no need to code. Internal mammary artery, there is no need to code. And they have not mentioned the word endoscopy, so we will not code anything about a saphenous vein. Now, this is the operative report. Patient with atherosclerotic heart disease underwent a coronary bypass grafting with a single graft from aorta to the distal left anterior descending artery and from the aorta to the distal right coronary artery. This procedure involved harvesting a segment of the greater saphenous vein utilizing the endoscopic vein harvesting technique to bypass the blocked coronary arteries. The sternum was opened and the left anterior mammary artery was prepped for grafting. However, due to poor flow through the internal mammary artery, it was not used. The pericardium was sharply incised and pericardial well was created. The end of the greater saphenous vein was anastomosis to the right coronary artery using 7-0 continuous Prolin suture distally. The remaining graft was placed on the left anterior descending artery at the junction of the middle and the distal third. After successful graft were placed on both the right and right coronary artery and the left anterior descending artery, the patient was weaned from the cardiopulmonary bypass and the chest was closed. The patient was stable post-operatively and transferred to the ICU. What ICD and CPT codes are reported for this encounter? What happened is they have done the grafting. How many grafting? For the 2 grafting. how the procedure involve, one graft is single graft from the aorta to distal left anterior descending artery and from the aorta to the distal right coronary artery. So the two graft, and for which they have taken the graft material from the saphenous vein. How did they do that? By endoscopy mean. And the internal mammary artery also they were trying to take, but there was not good flow, so they did not take the internal mammary artery. Now we have the enough information. CABG is done with two venous graft. The material is saphenous vein, and that is been endoscopically harvested. So let us see what is our we can zero down our answer. So by taking all the information, you can go through all these codes and tell me the answer. Yes, so the answer is B, 33511, two coronary artery venous graft, and since it is endoscopically harvested saphenous vein, we will have to additionally code that, and 33508. One more question. A 62-year-old female with a three-vessel disease and supraventricular tachycardia, which has been refractory to other management. She previously had a pacemaker placement and stenting of the coronary artery stenosis, which has failed to solve the problem. She will undergo CABG and autologous saphenous vein with the autologous saphenous vein and a modified MACE procedure to treat tachycardia. The risk and the benefit have been discussed, and the patient wishes to proceed. She is brought to the cardiac OR and placed in supine on the OR table. She is prepped, draped, and adequate endotracheal anesthesia is assured. A median sternotomy incision is made and cardiopulmonary bypass is initiated. The endoscope is used to harvest an adequate length of saphenous vein from her left leg. This is an uneventful and bleeding is easily controlled. The vein graft is prepped and cut to the appropriate length for the anastomosis. Three bypasses are performed, one to LAD, one to circumflex, and another distally to the circumflex. Modified MACE procedure was then performed and the patient was weaned from the bypass. Once the heart was once beating on its own again, we attempted to induce an arrhythmia and this could not be done. At this point, the sternum was closed with a wire and the skin approximated with staples. The patient tolerated the procedure without difficulty and was taken to the PSU. Choose the procedure. So from all this, you know that the CABG has been done, the vein graft, and how many vein graft has been put up, that is very important. So we need to figure out that that three bypasses are performed. So three bypasses, and all these three bypasses by endoscopically harvesting the saphenous vein which is given. So we have the enough information. So first eliminate the wrong option. So 33512, it is the code for the three coronary venous graft. We will require that code. 33535, it is the code for the three coronary arterial graft. It is not an arterial graft, the vein graft that has happened. So we will require this three code. Now the second code is 33254-257. What is this code that we need to check? Operating tissue ablation and reconstruction of the atria, limited example modified MACE procedure. And 33527, operative tissue ablation and reconstruction of the atria performing at the time of other cardiac procedure, uh, limited example modified MACE procedure, list separately in addition to the code for the primary procedure. So definitely this is a additional procedure because the CABG was the main procedure. So in between the 254 and 257, we will require the code 257, and so that will eliminate my option 254. Okay, so we have the option 257. Now this is the first code, this is the second code. And what is the code? 3350. It is a endoscopy surgical. So now we have enough information. We have eliminated option B, and we have eliminated option uh, A also, because 33254 is not the correct code. So our correct option is option C, because 512 talks about the venous. 33257, it is a code which we will take, and it's an add-on code. It is reported for the modified MACE procedure performed at the same time of the other cardiac procedure. Parenthetical instruction is under this code that lists which code can be reported with it, and 33508 is a endoscopic harvesting of the saphenous vein. So this is my last slide, and here we have completed the CABG. I hope you have understood the CABG well. And cardiac is a very vast section, so I'll be taking many individual topics.